Magandang hapon sa inyong lahat! Welcome to one of the episodes of the Technology Tour Vlog series for the National Science and Technology Week celebration in Western Visayas.
I'm Elle.
I'm Rai.
And I'm Hazel.
Ang kasama ninyo sa episode na ito.
Alam niyo ba na ang Western Visayas ay may mga natatanging yaman? Join us as we learn more about the world of drug discovery. Tara!
Welcome you to the Tuklas Lunas Development Center in Western Visayas, located in the center of the Philippines, Iloilo City. We are here in the University of San Agustin. Did you know that these centers aim to build our country's capacity for drug discovery and development by using naturally products-derived pharmaceuticals that will benefit us? Kaya dapat alam nyo na tayo dito sa ating rehiyon ay may pagmamalaki. And kasama natin ang DOST sa patuloy na pagsulong ng ekonomiya at pagpapabuti ng kalagayan ng pamumuhay ng ating mga kababayan. Tara, samahan ninyo kami!
Before we begin with our facility tour, let us first go back to the basics. Saan ba tayo dapat mag-uumpisa? Where does drug discovery begin? Every drug discovery story starts with the chemical compounds or substances produced by living organisms which are biologically active. Ito ay tinatawag na mga natural products. To have access to these natural products, the centers focus on the exploration of actinobacteria from the vast marine sediments surrounding the Philippine archipelago as a rich, untapped reservoir of novel bioactive natural products. Tayo ay sagana sa iba't ibang mga yamang dagat at lupa kagaya ng pinya, pigeon pea, fish poison tree, noni plant, at mga plant-derived products kagaya ng honey. Alam ko gusto niyo yung honey na isang pinagkukunan rin ng bioactive natural products.
Gamit ang multidisciplinary approach, ang C2B2, CND3 at Visayas NMR crosses over the boundaries of life science, physical science, and biomedicine with emphasis on natural drug discovery. Alam niyo ba na ang natural products ay makikita o matatagpuan sa smallest living organisms kagaya ng bacteria hanggang sa ating everyday food like kajos or pineapple. But how does the drug discovery story begin? Tara, kausapin natin ang mga scientists ng Visayas NMR, C2B2, and CND3 laboratories. Mag-lab gown muna tayo guys, bago tayo pumasok.
Let us get to know our science research specialist ng Tuklas Lunas Development Center. So we have...
Hi, ako po si Leslie Cubalida.
Hi, my name is Edna.
Hello, I'm Chuck.
Hello po, I'm Juliana.
Welcome to...
Tuklas Lunas Development Center!
So we have 7 laboratories here in the centers and I will tour you to each one of them. Tara pa! Yung diffusion cell na ginagamit para i-test yung effectiveness ng formulations na ginawa namin sa aming pananaliksik about sa antibiotic activity ng kajos. So tara, silipin po natin. So sa project po namin, which will be out in the market by the first quarter of 2020, Skivius toner at saka yung Skivius gel obtained promising results or obtained activity against a broad spectrum of skin pathogens. So ngayon po, puntahan naman natin yung MALDI Imaging Facility ng University of San Agustin, C2B2 at CND3. Tara po!
At dito po sa aming laboratory ay may dalawa kaming major na layunin. Una is alamin kung ano ang mga major components na matatagpuan sa aming samples. At ikalawa, saan saang parte ng ating samples matatagpuan itong mga major at unique components. So, ang una po nating sample ngayon ay pineapple. So, favorite niyo ba yung pineapple?
Yes, I love pineapple jam. Kumakain ka na.
Yes po. So, pineapple or pinya ay isa sa mga prutas na hindi nawawala sa hapag ng mga Pilipino because it can help improve food digestion. At may isang paniniwala na ang pineapple ay nakakatulong upang ma-lower ang cholesterol level na nagkukos ng heart attack or stroke. Ngunit wala pa itong scientificong basihan at dito sa aming laboratory, malalaman natin kung saang parte ng pineapple. So, next na ginagawa namin is analysis gamit po yung MALDI. Yung meaning ng MALDI is Matrix Assisted Laser Desorption Ionization. So, ito po, basically, gumagamit ng laser. Dito po sa likod, meron po siyang area dito kung saan pinapasok yung sample. Tapos, gumagamit siya ng laser. So, nililaser niya yung sample. Pero, hindi nasisira yung sample. Kasi, meron siyang coating doon ng matrix. Tapos, yung matrix yung tumutulong sa atin upang ma-identify kung saang parte ng pineapple matatagpuan itong mga unique components niya. So, sa mga kumakain ng pineapple, maging maingat po tayo sa pag-peel or pagbalat ng ating pineapple kasi yung mga major component na pwedeng makapagpababa ng cholesterol level ay makikita dito sa flesh niya or sa likod ng peel ng pineapple. So, sa pag-unlad ng siyensya at teknolohiya, mas na-enhance ang kaalaman natin kung ano ba yung major component ng mga kinakain natin sa pang-araw-araw tulad ng pinya.
Oh, that's very interesting talaga, Sir Chuck. And I personally, siguro kaming tatlo, marami talaga kaming na-learn regarding sa project yung pinya and also yung mga capacities ng C2B2 and CND3 in enhancing and discovering such information. So,
aside sa kajos at pinya na ating kinakain sa pang-araw-araw, yung ating likas na yaman ay hindi nagpapahuli sa pwede niyang mabigay na yaman sa atin. So, ito po ay mga beneficial bacteria na makikita sa buhangin. So, pupunta po tayo sa next na laboratory para malaman at tuklasin kung ano ang hiwaga na napapaloob sa mga beneficial bacteria na ito.
okay, let's go.
So, nandito po tayo ngayon sa ating next station, ang Microbiology Laboratory.
Hello po! Welcome po sa ating Microbiology Laboratory. Ngayon po ay tutur ko kayo sa aming project on marine actinobacteria. So, ang actinobacteria po ay isang grupo ng beneficial bacteria na nagiging source din ng iba't ibang gamot na ginagamit natin sa ngayon. So, yung aming team po ay pumunta sa iba't ibang bahagi ng Pilipinas upang mangolekta ng marine sediments. Ito po sila. So, these marine sediments po ay pinatuyo namin under sterile condition gamit ang biosafety cabinets. At ang pangatuyong buhangin ay tinatransfer namin sa solid marine media na magsisilbing pagkain ng mga beneficial bacteria na ito hanggang makapag-obtain po kami ng isang pure isolate. Yung pure isolate po is ibig sabihin isang uri ng bacteria lamang ang tumutubo sa isang plate. So, after naming makakuha ng pure isolate, tinatransfer po siya namin sa isang maliit na tube na may laman tulad po nito, na may laman po na pagkain din. Then, ito po ang magsisilbing stock culture natin at isinustore po natin siya doon sa may -80 freezer. Doon sa freezer kayo?
Yes, pupunta tayo doon sa kabila para makita ninyo ang ating library na tinatawag nating biobank.
Okay, fine.
Let's go! Let's go! So ito po, yung dalawang malaking freezer na ito ay ang ating tinatawag na biobank. So ito po yung nagtatago ng ating mga actinobacteria na na-isolate natin from the different parts of the Philippines, including po yung Western Visayas. So, to show you po what's inside, ito po yung ating library. So, bawat kahon po ay naglalaman ng mga isolates na nakatago, and this is for future researches. So, kung mayroon man pong mga
future scientists, ng mga estudyante na gusto din pong mag-aral tungkol sa actinomycetes, hindi na po sila kailangan pang pumunta doon at saka mangolekta ng marine sediments. Punta lang po sila dito at pwede na silang kumuha dito ng isa at pag-aralan nila in the future. So we have more than 3,000 po na actinobacteria na ready for future research po. So after po dito, i-walk through ko po kayo sa process paano kami nag-isolate ng compounds at paano po kami para sa aming drug discovery research.
Okay, try na.
Dito po tayo ulit. So dito po sa microbiology lab, nanggaling ang lahat ng mga raw materials for our drug discovery program. So dito po nagaganap yung isolation at saka yung large-scale fermentation. Ibig sabihin, pinapatubo namin ng maramihan ang ating single na actinobacteria. So, nakafocus na tayo sa isa, hindi sa 3,000. Instead, ma'am, napatubuin siya namin sa isang plate, pinapatubo po natin siya sa maraming pans. So, para ma-expedite pans. So, that is to expedite or paramihin din yung produce niya na mga importanteng mga chemicals and compounds for our drug discovery research. So, after we have yung large-scale fermentation, mina-harvest natin siya, then pino-forward for extraction doon sa chemistry laboratory.
So, pupunta po tayo
Yes,
ngayon
pupunta
doon.
tayo ngayon sa chemistry laboratory. So, come on! So, ito po yung ating chemistry laboratory. Next. So, nandito tayo ngayon sa ating chemistry laboratory kung saan dito tayo nag-extract ng secondary metabolites. So, si rotary evaporator po, tatanggalin niya yung mga solvent at matitira lamang yung extract doon sa may flask. So, after that, ibibigay po siya ulit doon sa may microbiology laboratory.
Balik tayo doon. After dito. Okay.
So, after po niyan matuyo, forward siya ulit doon sa microbiology laboratory para doon naman siya iti-test against sa ating mga pathogens. So, dito po sa ating drug discovery program, nagtitest po tayo against escape pathogens. So, these are different bacteria po na mahirap patayin. So, they are developing resistance na po sa mga gamot na readily available sa ating market. Sa purification po, yun po yung time na hihiwalay-hiwalayin na natin yung mga compounds para makita natin kung saan doon yung nag-cause ng antibacterial activity. So, yung first purification po natin ay gamit itong malaking parang pencil. So, this is a column po. So, we're doing gel permeation chromatography. So, wherein yung crude extract po natin, yun yung galing talaga doon sa may extraction, yes. Isa-separate po siya based on the size nung compounds na meron tayo. So, dito sa process na ito, si biology, yung magiging mata ni chemistry, para hanapin kung saan doon yung may pinaka-active yung tawag natin doon. Ibig sabihin, siya yung may antibacterial activity. So, after that, pag sinabi ni biology na si number 1 yung may antibacterial activity, i-forward siya again for another purification using ang ating flash column chromatography. So, sa flash column chromatography naman, sinaseparate naman yung compounds, ang molecules, based on their polarity. So, then again, after nun, pag nakakolect tayo ng different fractions ulit, itetest siya ulit for bioactivity screening. So, we have the antibiotic screening and we have the anti-cancer screening also. So, yung anti-cancer, ma'am, doon sa kabila sa may cell culture.
Okay.
Pupunta tayo doon mamaya.
Okay, sige.
Then, yun yung ating bioassay guided purification. So, the chemistry, the biology becomes the eyes of the chemistry. Then, we decide kung ano yung fraction na ating i-pursue for purification. So, hanggang makakuha tayo ng pure na compound, which is isa na lang siya.
So after po nito, doon na tayo sa...
Yes. After nito, ma'am, iti-test siya ulit. Once na-prove na ito yung fraction na to, na pure compound, ito yung may activity, siya po ang ating isa-subject for metabolomic na profiling. Ibig sabihin, kikilalanin natin kung ano ang kanyang pangalan at saka kanyang structure. Opo.
So medyo makaba-kaba pala yung process ng drug discovery and development. And syempre, minimake sure din na tama yung mga compounds na discover.
Yes, ma'am. Because yung drug discovery po, hindi po siya overnight na na process. Like, what we are doing here is the basic. So, from discovery, maraming pa siyang pagdadaanan after that. So, pagkatapos nating malaman, na makuha na meron na tayong bioactive na pure na compound, pupunta naman tayo doon sa mass spectrometry laboratory para malaman ang kanyang identity. So, halik kayo, punta tayo doon. So, ito po ang ating mass spectrometry laboratory kung saan para siyang timbangan ng mga molecules.
Ano po yung importance ng equipment na to sa drug discovery?
Bale, ma'am, binibigyan na tayo ng idea kung anong klaseng compound yung ating na-isolate. So, that will help us identify yung kanyang structure later on. So, after nating malaman yung putative identity, kailangan natin i-confirm kung ano ba talaga yung pangalan ng compound na yon. So, pupunta tayo sa NMR laboratory.
Or the nuclear magnetic
resonance.
So after we have identified the putative identity of our compound using the LCMS, we are now going to elucidate the structure using the 600 megahertz cryoprobe NMR here in the NMR laboratory.
So after nating malaman yung identity ng ating compound, titest naman natin siya for downstream analysis. So that will include yung ating minimum inhibitory concentrations for antimicrobial screening, yung IC50 for anti-cancer, at saka yung toxicity assays. So, tawagin natin si Miss Juliana to explain more on this aspect.
Hello po!
So we actually do a lot of bioassays experiments, yung minention niya kanina, which is the MIC, the IC50. So yung dalawang bioassays experiments na iyon, ginagawa natin yun para tignan natin if yung compounds, anong concentration ng compounds yung epektibo sa pagpuksa ng bacteria at pagpigil ng growth ng cancer. And for the toxicity po, tinitest po natin yung compounds na na-identify dun sa LCMS natin if safe po silang gawin isang gamot po.
Welcome to Cell Culture Laboratory!
So, tignan po natin yung laboratory namin kung saan ginagawa, mostly our anti-cancer experiment. So, pasok po tayo. So, dito po sa cell culture, meron po kaming dalawang incubator na ginagamit to store our cell lines. So, parang bahay po siya ng cell line namin. So, dito po namin sila pinapatubo para gamitin sa aming mga experiment. At makikita po natin dito, meron po kaming microscope in which we use this to monitor the growth of our cell lines if okay na po siya para sa aming mga assay. So, meron po tayong flow cytometer dito. So, yung machine na to, it help us to assess cell population in real time. So, if meron po tayong 10,000 cells, makikita po natin all 10,000 cells po dito sa flow cytometer. So, ito po sila. Yan po yung example. So, yan po yung cancer cells natin na nilalaan dito sa flow cytometer. So, yung samples po na tinitest namin against our cancer cells, so nanggagaling po siya sa chemistry. So, basically, yan po yung compounds na in-identify rin sa LCMS. At yan rin po yung compounds na pinaprocess sa microbiology. So, parang interconnecting web po yung laboratory namin. So, whatever po na product na pinoproduce ng micro, then chem will process it, then we will just analyze the activity of those compounds. So, yung cell lines po namin, binibili po siya namin from a trusted supplier at pinapatubo po siya namin. So, yun po.
So, meron po kayong masasabi sa ating mga viewers?
So, in drug discovery research, there is actually a famous saying na fail now, then fail later. That is why it's very important to assess the toxicity of the compound at the early stage of research because it will save you your efforts, your resources, and especially the time that you will invest in your work. So that in our drug discovery program workflow in search for antibiotic drug lead produced by actinobacteria from the marine sediments of the Philippines.
Wow, gandang saying no, napang motto,
Yes.
fail now than fail later.
So in the 4 years since we've inaugurated C2B2 and CND3, we have partnered with industries to make antibiotics accessible to all Filipinos. So we have here from Kajus project, this will be out in the market in the first quarter of 2023. And right now we also have Hanel. So this is available in Shopee. So for all of you consumers who are fond of doing online shopping, you can find this online. So just search Hanel. So Hanel is a product of the Honey Project here at the centers.
Welcome to USA DOST PCHRD Tuklas Lunas NMR Laboratory in Visayas.
So, welcome po to the first NMR laboratory here in Visayas and Mindanao. The first of its kind here in the Philippines and fourth here in Southeast Asia. So for clarification, this instrument does not have any radioactive materials. It contains a superconducting magnet. So nuclear magnetic resonance, or NMR for short, can be used to determine the structure of drug leads natin. It can also be used para malaman if paano nag-bind yung drug sa kanyang targets, no? And it can also be used to determine the structure ng mga viral proteins natin. To use the NMR, we put our sample in what we call NMR tube, and then we put in the spinner just what we have here. Ito po siya, no? Example po yan. Ilalagay siya dito, and to put the sample in the magnet, you can use the workstation or you can push it here.
Okay, now let us learn more about our NMR laboratory from one of our DOST balik scientists. We have Dr. Julius Adam Lopez. Hi, Doc. We would like to know more about the NMR laboratory, Doc. Yes, I have here Miss Hazel that will ask you more about the NMR.
Sige.
Thank you very much, Doc. So another question, how does the NMR facility complement with existing Tuklas Lunas Centers?
Okay, in relation to that, ang ating mga Tuklas Lunas Centers po ay kalat sa buong Pilipinas, hindi lang po ito sa Luzon. No? Marami po dito sa Visayas, sa Mindanao. In fact, 4 out of 5 ng ating drug track Tuklas Lunas Centers ay nasa Visayas and Mindanao. When you say drug track, they focus on drug discovery up to the structural elucidation ng ating mga compounds. No? So, for the structural elucidation ng ating compound structures, kinakailangan po niyan ng NMR technology. So, malaking bagay po talaga na meron na pong NMR facility dito sa Visayas and Mindanao. Malaking tulong po ito para magkaroon ng capacity in terms of NMR technology dito sa Visayas and Mindanao regions.
Thank you very much po, Doc.
Yes, thank you.
Thank you, Rena. It was a pleasure having you.
Ngayon naman, let us meet the Director for the Center for Chemical Biology and Biotechnology, or C2B2. We have Dr. Doralyn Dalisay. Doc, how important are these centers for the drug discovery initiatives of the Philippines?
The Innovative Drug Discovery Center at the University of San Agustin will support better health outcomes for Filipinos. We formed a dynamic and interdisciplinary network that brings together the best people, technologies, and tools to enable early-stage drug discovery research in the Philippines, targeting infectious diseases, cancer, and metabolic diseases. Our initiative focuses on designing and developing innovative tools and techniques to identify bioactive molecules from Philippine natural resources such as marine bacteria and functional foods with high potential for industry uptake and clinical translation. More importantly, the Drug Discovery Center at the University of San Agustin focuses on creating therapies for future infectious diseases outbreaks, thus enabling the Philippines' preparedness should there be an emerging pandemic in the future.
Doc, how can we encourage our young scientists and institutions here in Western Visayas to go into drug discovery research?
That is a very relevant question because it involves human resource competency building as well as infrastructure development. Let me start with young scientist encouragement, and my thought is that effective and productive R&D is driven by a higher purpose and not just by the quintessential short-term goals such as publishing for career promotion or institutional accreditation. Hence, the desire and the passion to serve the community through R&D is a personal and internal matter, and motivational approaches are as variable as every individual.
We hope na sa mga susunod na taon is makabuild kami ng partnership, collaborations from the different institutions and different industries dito sa Pilipinas upang makakome up po tayo with products from the different researches and for the Filipino people. Sa muli, kami po ang mga research assistants na bumubuo sa Center for Chemical Biology and Biotechnology at Center for Natural Drugs Discovery and Development. We are the Tuklas Lunas Development Center in Western Visayas!
That ends our technology tour for C2B2, CND3, and NMR Laboratory. Marami ba kayong natutunan sa episode natin today?
Handa na ba kayo na maging bahagi ng drug discovery research sa Western Visayas?
We hope you will visit the Tuklas Lunas Development Center in Western Visayas. I am Hazel.
I am Rai.
And I'm Elle.
See you around!
Thank you, everyone!